lot of the patients have been through spinal fusion surgery. Spinal fusion surgery is not a walk in the park. They've been through the pain management clinic, nothing's working, and they're thinking, oh no, not another spinal fusion. And then you tell them, oh no, this is nothing like that.
Excruciating. Couldn't sit, couldn't walk, couldn't stand. Didn't matter what you did, you couldn't get out of pain. And the pain was from the middle of my spine on the right side, came all the way around and shot all the way down to this thigh.
Mrs. Ruck has had, unfortunately, a number of spinal fusion surgeries. It really came to the point where she needed a walker to prevent falling down. We MRI'd her spine, which really looked fine, and it turns out that this debilitating pain was coming from her SI joint. Well, the SI joint is important in my world because it causes pain. It's where your spine joins your pelvis. The problem with the SI joint is it's very difficult to diagnose. So you could get MRIs, you could get X-rays, you can get CT scans. Nothing is really gonna show, oh yeah, there it is, it's the SI joint.
He says, you can do nothing. You can take pills, you can do shots, or you could do surgery. And I said, you know what my answer is.
The full name is Sacro-Illiac joint fusion. You make a small incision on the outside and the back of your hip, and you take 3 spacers, put them across the SI joint, and that's the procedure. The end result is the joint no longer moves. So that pain that comes from the joint moving is eliminated. But the traditional surgery, you make a cut in the back, essentially create a fracture in the SI joint, fill the joint up with bone graft or bone protein, close it back up, put screws in. The new procedure doesn't involve fracturing the pelvis. So number one, it's not going to hurt as much. You're generally out of the hospital the next morning, walking around. You might be limping a little bit, but you don't necessarily have to use crutches or walker, as was the case with the traditional surgery.
Pain was gone. When I got out of the bed and stood up, and I said to Angie, look, I'm standing all by myself. It was unbelievable.
In terms of activities of daily living, getting back to work, doing recreational things, you know, it's probably in the neighborhood of like 6 weeks. And that road to getting there is much easier than the previous surgery or a spinal fusion surgery. We're one of the 20 centers chosen from across the world to report and follow these patients to see, does it really work? The results so far have been very good. What I like about this procedure the best is people are happy with it.
Dr. Squillante, he's my surgeon. I'm telling you, he's my man.